GLP-1 medications were developed to treat type 2 diabetes.
They were shown to increase insulin production by the pancreas, reduce blood sugars, decrease the hunger, and many things for patients with diabetes.
And today, they're also being prescribed for weight loss.
They work in a bunch of different ways, but the primary ways that they work is they're going to be stimulating insulin, slowing our digestion, and then regulating our appetite.
But it's crucial to recognize
there is no magic pill. These are life-changing, life-saving medications, but they absolutely need to be in the hands of the right person at the right time.
Discover the wait is over. The rise in GLP-1 medications for weight loss. Inside this edition of CTSI Discovery Radio. Welcome to CTSI Discovery Radio. I'm your host, Brian Belmer. CTSI Discovery Radio is brought to you by the Clinical and Translational Science Institute of Southeast Wisconsin. The CTSI is a consortium of researchers, doctors, scientists, and others representing 8 institutions, including the Medical College of Wisconsin, Milwaukee School of Engineering, Marquette University, the University of Wisconsin-Milwaukee, Children's Wisconsin, Froedtert Hospital, Versity, Blood Center of Wisconsin, and the Zablocki VA Medical Center. The CTSI works collaboratively across all of our member institutions. Our mission is advancing health through research and discovery. It seems every day we hear about them. GLP-1 medications for weight loss. On TV, online, on social media, everywhere. But what do we really know, much less understand, about them? How do they work? Do they work for losing weight? And are they safe to take? So many questions. And on today's show, we get answers from some experts, beginning with Dr. Srividya Kadambi, Professor, Department of Medicine, and Chief, Division of Endocrinology and Molecular Medicine at Froedtert and the Medical College of Wisconsin. Now, there may be a perception that GLP-1 drugs are new medications, but is that accurate?
Not quite. You could say that it was approved for weight loss. A little bit later, indication for obesity is somewhat newer, you would say. But the newer drugs that have come into the market changed the landscape. So the older GLP-1 drugs were not as effective as these newer ones.
Dr. Kadambi tells us GLP-1 agonist receptor drugs were first specifically prescribed for patients with type 2 diabetes because
they were shown to increase insulin production by the pancreas. They also reduce blood sugars and decrease the hunger and many things that would be beneficial for patients with diabetes. So it was originally developed just for type 2.
However, not long after they began being prescribed, doctors and patients began noticing
some weight loss or not much weight gain, which is what you see when you treat diabetes. So that's what started the interest in patients with obesity.
We asked Dr. Kadambi to share a brief explanation of the most common forms of diabetes, type 1 and type 2.
Type 1 is an autoimmune condition where the cells in the pancreas that produce insulin are destroyed by our own immune mechanism. And so there is an absolute deficiency of insulin. These people don't have any insulin, so they are insulin dependent.
Okay, what about type 2 diabetes?
Type 2 is a different kettle of fish. Here, the body is actually resistant to the insulin. So often, many patients with type 2 diabetes have actually higher amounts of insulin than you would see in a normal person without type 2 diabetes. So what happens is body tries to keep up as our body gets insulin resistant. It could be by acquired factors like obesity. Pancreas, over time, cannot keep up with the amount of insulin that's needed.
She gives us this example.
Let's say one's body needs 40 units of insulin. When there are conditions that are causing insulin resistance, most common one being obesity, our body can make higher amounts of insulin. So let's say now the body needs about 80 units of insulin or 100 units of insulin. Someone with robust pancreas can make 100 units.
But let's say that person develops insulin resistance due to continued weight gain and
your body now needs 120, 140 units of insulin. Now the pancreas can no longer keep up. It's still making 80, 100 units, more than 40 that's needed, but it can't make 120, 140. So that's type 2 diabetes. And you will see a lot of patients with obesity don't have type 2 diabetes, mainly because their pancreas can make the 120 or 140. They don't develop type 2 diabetes. So the type 2 diabetes is a combination of insulin resistance and relative insulin deficiency, meaning that your pancreas cannot make that extra amount that your body needs.
then how do the GLP-1 agonist receptor drugs work in treating type 2 diabetes?
The GLP-1 agonists, they do actually stimulate pancreas to make a little bit more insulin. They also decrease another hormone called glucagon that causes our liver to make more sugar. So by decreasing that extra glucose production that you will see in patients with type 2 diabetes decrease. But the major way is by decreasing body weight. Decreases hunger, the patients are eating less. So you would need less insulin that is required for the food. By decreasing the amount of food intake, it decreases body weight.
What are the different classifications or types of GLP-1 drugs?
You could classify them in two different types. So one is based on duration of action, daily versus weekly. You can also classify them as oral versions versus injectable versions. But the main types that are coming up are what we call a single agonist, dual agonist, and triple agonist.
So what's the difference between them?
GLP-1 is a part of a class of hormones called incretins. So the original first ones that came about, dulaglutide, semaglutide, they are single agonists towards only hormone called GLP-1. So those are the ones that we have had first.
Then there's dual GLP agonists.
The dual agonist, there is another incretin hormone called GIPs. So the GLP-GIP agonist is the new tirzepatide, which is sold by name of Mounjaro for diabetes, Zepbound for obesity. So those are the new dual agonists. Duals seem like they have a little bit more weight loss efficacy in diabetes, but all of them work well.
And on their way, triple GLP agonists.
The triple agonists that are in phase 3 trials, hopefully we'll see them 2026 or maybe 2027, but they are agonists to the two GLP-1 and GIP, and there is glucagon in there in the triple agonist.
Plus, there are multiple additional compounds in development.
Only single and dual agonists are in market right now, but the triple, quadruple, and penta agonists are being researched upon. But triple agonist is definitely closer to finishing up their phase 3 trials.
As an endocrinologist, what was Dr. Kadambi's initial reaction to using GLP-1 drugs specifically for weight loss? Was there any early concern about using them in the absence of type 2 diabetes?
I was a very early adopter of this drug because it was very evident that these would be very good weight loss drugs. We waited until trials were completed to be able to prescribe to people with just obesity and without diabetes. I'm glad that after 20 years, there is a clearer view that these are safe and we can use them in almost everyone, including children.
Which isn't to say there aren't any concerns about taking a GLP-1 drug for weight loss.
Of course, there are a lot of concerns. Just like any other drug, you should never use any drug without proper supervision. My concern right now is people not using it appropriately. Each one of these drugs is approved as an adjuvant to lifestyle modifications. So it is possible that people and providers forget diet and exercise and behavior modifications that you do need to get the weight loss.
In other words, there's work to be done. But if you do the work,
take the drug with the help of a clinician, adequate protein, hydration. I also ask patients when they are on higher doses to take a multivitamin, making sure that they're getting all the nutrition they need.
You can safely lose weight.
Weight loss with the new drugs is approaching 20%, 22%, some people even more. In fact, some of them are knocking on the door for bariatric surgery levels of weight loss. Not quite, but almost there. So, yeah, they work.
Next, we gain lots of insights on the pharmacological properties and primary actions of GLP-1 weight loss drugs from another expert. Dr. Rachel Cavanaugh is an associate professor and director of patient care labs for Year 2 students in the School of Pharmacy at the Medical College of Wisconsin. Dr. Cavanaugh first gives us this brief overview of GLP-1 receptor agonist medications.
GLP agonists, they're medications that are really used to help reduce blood sugars, help slow gastric emptying, and they can also reduce food intake overall. Really what they're designed to do is help both with diabetes and obesity. They do need to be taken with oversight from a healthcare provider like a physician, nurse practitioner, or a pharmacist to really make sure that they're being used safely and most effectively.
She tells us what GLP-1 stands for.
GLP-1, it's really short for glucagon-like peptide 1. When I talk to my patients, I just tell them it's really alphabet soup for a natural hormone that is produced in our gut after we eat something.
What about receptor agonist?
Receptor agonist specifically, it's a molecule, so like a drug or a hormone or maybe a neurotransmitter made by the body that's going to bind to a specific spot on a cell that's called a receptor. And when an agonist binds, it's activating that cell, or it's telling that cell to do something, such as producing a response within the body.
Got it. So, when you put it all together,
a GLP-1 agonist, a medication, is going to mimic the response of our naturally produced GLP-1 hormone. So it's going to bind and activate to the exact same cells in the body to simulate very similar responses to what our natural hormone is doing.
Next, Dr. Cavanaugh shares insight on the history of GLP-1 medications on the market from a pharmaceutical perspective.
The first GLP-1 was actually discovered in 1984. Initial research and applications for it really focused on diabetes treatment. And we didn't see our first GLP-1 agent until 2005. And this was exenatide and branded as Byetta. Again, it was used for diabetes.
Over the next few years, more GLP-1 agonist receptor medications came into the market.
We had liraglutide, which was Victoza, came out also for diabetes. And then we had dulaglutide come out, Trulicity, also for diabetes. The popular one now, Ozempic or semaglutide, actually didn't come out until 2017.
The first GLP-1 to be approved for weight loss
didn't get approved until 2014, and it was actually liraglutide. Originally came out as Victoza, but it was rebranded for weight loss as Saxenda. So it's been kind of a journey, starting with diabetes and then slowly pushing over into the weight loss realm.
How do GLP-1 medications work for weight loss and weight management?
They work in a bunch of different ways. We have GLP-1 receptors kind of all over our body. But the primary ways that they work is they're going to be stimulating insulin, slowing our digestion, and then regulating our appetite.
Dr. Cavanaugh explains these three primary actions individually. First, stimulating insulin.
When our body detects a rise in blood sugar, so after we've eaten a meal or a snack, that GLP-1 hormone is released, and it's stimulating the release of insulin from our pancreas. Insulin works a lot of different ways on a lot of different organs, but it's really helping to remove glucose from the blood. So it's going to promote the synthesis of glucose storage molecules called glycogen. It can promote the creation of proteins, and it's really helpful for patients who have diabetes because they often have a degree of insulin resistance.
So, by adding more GLP-1 into the body,
we're stimulating more insulin release, which can then further reduce those blood sugar levels.
The second and third primary actions of GLP-1 medications are slowing digestion of the food we eat and appetite regulation.
The GLP-1 hormone also helps to slow down how quickly our stomach is emptying the food into our intestines. So that food is sitting around in our stomach a little bit longer than it normally would, especially if you're on a medication. And it's also telling our brains that we're full. So oftentimes patients who are on a GLP-1, they're going to find themselves feeling fuller faster for longer, and they're not going to be interested in eating as often as they would if they're not on a medication.
But while GLP-1 medications know what to do in our body, weight loss still requires mindfulness of the person taking it.
So it's really important for them to be very mindful of what they're eating. We tell our patients on these medications, when we sit down to eat, we want to make sure that they're starting with those healthy foods. those lean proteins like your chickens and your fish, and then having your fruits and vegetables, and then lots of water. We want to make sure that we're starting with those good, healthy building blocks before they move on to, say, like the desserts or the really heavy carb foods. Those foods do tend to make people feel a little bit more unsettled than these healthier options.
After all, despite what some may think, this isn't just some magic pill.
Absolutely, yeah. This is definitely not a magic pill. It's not fair or appropriate to tell patients that they can just take this medication and do absolutely nothing else. They need to be very mindful of the food and the diet that they're taking in, the exercise habits, and the other lifestyle changes that they're making. It is really just one additional piece to the puzzle to help with the weight loss.
Just like me, I'm sure you've seen lots of advertisements for GLP-1 medications. But what's the difference between them?
Without getting too deep down the rabbit hole, there's a couple different types of medications out there for the weight loss that are called GLP-1. So there's a GLP-1 only agonist, and that's like your semaglutide or your Wegovy, and then your liraglutide, which is your Saxenda. And these work only on the GLP-1 receptors.
However, more recently, we saw the introduction of
tirzepatide, which is Zepbound, and that one's actually a combination of a GLP-1 with a GIP, glucose-dependent insulinotropic polypeptide. Another bunch of alphabet soup to say that we have more natural hormones that are doing very similar things to the GLP-1, promoting insulin secretion, regulating blood sugar, and it's stimulating that feeling of fullness that patients have.
So these different medications are essentially doing the same thing and producing the same outcome.
But they're working on multiple different receptors located throughout the body. So it's an interesting medication because it's working in so many different parts of the body. And each medication that's out there, they work very, very similarly, but they might be affecting certain receptors, say in the gut versus the brain, just a little bit more than the other one. But overall, this whole class of medication works very similarly.
As far as how often someone takes a GLP-1 medication for weight loss, that depends on which one you're taking.
The liraglutide or Saxenda, it's actually a once-a-day subcutaneous injection. The semaglutide or the Wegovy injection and the tirzepatide or Zepbound injection, those are just a once-a-week subcutaneous injection. And just within the last couple weeks, Wegovy released a brand new oral tablet, and this one is administered once a day. So we have a lot of different options for patients.
How quickly does weight loss begin?
Some patients can start to see results in a couple days or a couple weeks. We do start patients on, I call them the baby dose of the medication, and that little dose isn't designed to see significant weight loss. So I do counsel my patients to be patient, to get the body used to the medication. So when we go up on those higher, more effective doses, they're really going to see the weight loss with fewer associated side effects.
Speaking of side effects, some of the more common ones patients may experience.
Patients might have some abdominal discomfort. That's pretty common because, again, the food's sitting around a little bit longer than they're used to. Other side effects can be constipation or diarrhea, vomiting, and then really with any medication, it can cause headaches or some fatigue.
Fortunately, these can typically be overcome.
Adjusting the diet a little bit to have smaller portion size, protein-heavier meals can really reduce those troubles. And then staying hydrated also really keeps those bowels moving so we don't have as many issues with constipation.
Regarding eligibility to be prescribed a GLP-1 medication for weight loss,
they're not for everyone. They are typically recommended for patients who have a body mass index of at least 30 kilograms per meter squared or a BMI of at least 27 who have at least one additional weight-related comorbidity. So that would be high blood pressure, high cholesterol, type 2 diabetes, moderate or severe sleep apnea, or heart disease.
Are there people who cannot or should not take GLP-1 medications?
Absolutely. Patients who have a personal or a family history of something called medullary thyroid cancer or multiple endocrine neoplasia syndrome type 2, patients who have inflammatory bowel disease should probably avoid these medications or use them very cautiously. Patients who have a history of pancreatitis should also use GLP-1 medications very cautiously. Patients who are currently pregnant or breastfeeding should really not be on a GLP-1 due to the potential risk to that baby.
It's also important to note
GLP-1s also make oral hormonal birth control pills less effective. So if you don't want to get pregnant and you do want to go on a GLP-1 and you're sexually active, we should really be looking at alternative methods of contraception.
But all things considered, are GLP-1 receptor agonists indeed effective for weight loss?
The medications are actually very, very effective. What we're looking at is healthy weight loss of about 1 to 2 pounds per week. But it is really interesting to note the medications, very effective, but they're pulling the weight from the fat, but also from our muscle tissue. So it's important to really maintain those high levels of protein and participate in resistance training exercises to help keep those muscles engaged and active.
Are GLP-1s safe to take for weight loss?
Generally speaking, GLP-1 medications are safe for most people to take. Each patient obviously needs to be reviewed thoroughly with a physician or a pharmacist or a nurse practitioner before starting it.
Is it expensive to be on a GLP-1 medication?
Price varies significantly. I have seen some insurances cover these GLP-1 medications at no cost to the patient. But then I have seen other insurance companies charge hundreds of dollars per month. So before you decide to go through the insurance or do the cash pay option, it's always a good idea to talk with your insurance company to determine if these medications are on your plan, and if so, what the estimated cost is going to be.
And while losing weight with the help of a GLP-1 may seem priceless,
I view them more as like a jump start to a healthier living. It's not a magic pill, and it's incorrect to think somebody can just take this medication and do nothing else and magically become thin.
but with the right approach,
GLP-1s, they're great medications, but they're also not benign. So really important to work with your physicians, your dietitians, your pharmacists, your family, your friends, and really making this weight loss journey more enjoyable and ultimately more long-lasting for your overall health.
to have a truly comprehensive conversation about weight loss, it's vital to consider not only the physical, but the psychological impacts of weight loss as well. To round out our show today, we reached out to Kate Glassnap for additional expert insight. Kate is a nurse practitioner, faculty staff member, and co-director of the Comprehensive Medical Weight Loss Program at the Medical College of Wisconsin. Kate shares what the program is all about.
We're extremely proud of our program. I think we're one of the few in the state of Wisconsin that house both the medical approach to weight loss and the surgical approach to weight loss. So our goal is to offer patients a multidisciplinary approach to their weight loss, looking for not only weight loss, but a sense of vitality.
The program combines a variety of experts and specialists.
We have the endocrinologists and we have the surgeons, but also dietitians, pharmacists, psychologists, and our nurse practitioners and physician assistants. So it is a comprehensive program.
And while focus on physical impacts of weight loss for a patient are key, equally and arguably more critical are the psychological impacts.
What negative psychological impacts may a person be experiencing because of obesity, because of carrying excess weight? Everybody's got their own journey, their own experience, but often there can be challenges with self-confidence, a sense of isolation, depression, anxiety. People will experience bullying, discrimination.
But conversely, what positive psychological impacts can weight loss have on a patient?
What you'll see is many improvements in the emotional health and sense of well-being, and that can translate to overall improvement in quality of life. And oftentimes we see people better able to invest in their self-care. They're better able to take care of their arthritis, their diabetes, their heart condition, just because they feel better about themselves and some ability to manage challenges that they've had.
How do Kate and her teammates assist patients in facing and overcoming psychological impacts of weight loss? She says the process begins with
just by getting to know the person in front of us. That is key to our program because everybody brings different challenges. Sometimes people present with challenges they don't know that they have. So I think it's important to look at who is the person in front of me and what are they saying they want? What do they feel they need? Always critical to understand what are their expectations of this journey.
another crucial question to consider.
What do you think will change with your weight loss, because one misconception is that if I lose weight, it will fix X, Y, and Z.
And the hard truth is, it might, but it also might not, because
oftentimes weight is a symptom and not the cause. So having that discussion, finding out what patients are willing to do, what are they ready to do. Maybe there are so many barriers in life, this is not the best time for them to be taking on additional challenges.
or this common psychological barrier to overcome in the pursuit of successful weight loss.
Looking at past weight loss ventures, what have they tried, and where have their successes been? Because that will help to inform our future journey. So obesity really did not happen overnight. Our behaviors did not occur overnight. And so part of it is patience and setting realistic expectations. That's a critical part of the venture.
With the advent of GLP-1 medications for weight loss, is there cause for concern, especially relative to psychological impacts of weight loss?
It is a really good question, Brian. I think we have a lot of misconceptions about the medications. There's a lot we don't understand.
Coupled with the very real problem.
Anytime we look for a quick fix to obesity, we're in trouble. This is a chronic, relapsing disease. It needs chronic attention. It is a lifelong journey. And we've had trouble with patients that have spent way too much money in order to get the medication. Anywhere on social media, you can get the magic pill.
But again, spoiler alert,
there is no magic pill. And the concern is these are life-changing, life-saving medications, but they absolutely need to be in the hands of the right person at the right time.
Because in the wrong hands or at the wrong time,
there are significant negative psychological consequences when people reach a level of desperation. And I continue to say that it isn't the medication that does all the work. It is the medication in the hands of somebody finally ready to do this and do this right.
And for the person ready, both physically and psychologically,
yes, these are terrific medications. Tremendous upside. There's tremendous advantages. And of course, we know that they are life-changing. This medication may not be appropriate for every person. But as long as we are attentive as providers and prescribers, I think the benefits far outweigh any misuse or misinformation that's out there.
By the way, if you do take a GLP-1 and someone asks how you're losing weight,
your first answer should be, I'm doing the work. But if I say, I've lost weight because of this drug, then I'm giving the drug all the power. And then we've got some work to do because a medication cannot do the work for us.
When it comes to weight loss, Kate says it's a personal journey. Your story is just that. Your story.
Make this your own journey. It's an individual experience, and that's what your team is there to support you through.
And by all means, rely on your support team, not the scale.
You're more than the numbers on the scale. So, yes, there is life after the scale. The number on the scale simply informs us. It's not a judgment about who I am. And I think that's an important thing to keep in mind every single day.
I think so too. And I know we're all out of time for this edition of CTSI Discovery Radio. Thanks to each of our guests for appearing on today's show. Dr. Srividya Kadambi, Dr. Rachel Kavanaugh, and Kate Glassnap. I hope you've discovered something by listening to today's show. And I'm doubly hopeful you'll join us again next time. CTSI Discovery Radio airs the third Friday of every month. Make an appointment on your calendar and join us for each episode. On behalf of the Clinical and Translational Science Institute of Southeast Wisconsin and all of our affiliate partners and members, I'm Brian Belmer, wishing you happier, healthier days ahead. For more information about research or to listen to the podcast of this or any of our shows on demand, please visit our website at ctsi.mcw.edu. CTSI Discovery Radio is written, produced, and hosted by Brian Belmer in collaboration with WMSE Radio. The CTSI and this program are under the direction of Dr. Julie Freed.